Okay, chapter 24, infant, child, and teen. So it's a continuation of module 8. So basically, as what we have mentioned, I think in PSW Foundation module 1, that you will not be only focusing on the elderly care client, middle aged, anything like that. Also, infant, child, or children, or even teenagers, they might be your potential clients, right? So again, you support across all ages, even with the children and elderly. Always remember that there's always rights that they possess. They always have the rights, whatever, like even following the DIPS process. It's always whether it is applied to all ages. So again, the DIPS process, as a reminder, it means dignity, independence, individualized care, preference, privacy, and safety of the client, right? So, in terms of these younger ones, potential clients, there are also responsibilities in the family context. So, make sure that the family is maintaining stability, they secure the environment, anything like that, especially if the client lives in their own home, right? They should also support not only the PSW but the totality in doing the daily routines. Also, the family member will also reinforce household behavior rules. They should give you the rules and regulations every time you visit their own home, because again, children cannot make their own decisions. It should be the parents or whoever the legal guardian is, right? And especially if they are like, if they're not are have disabilities, anything like that, or any disorder. So that add ups. So also observe they should observe for stress or harm indicators that it might happen, or potential things that might happen in the environment. Nutrition and development. So again, we all know that food fuels growth and development for individuals. So it should always be applicable. There should always be the proper nutrition that you give to the young clients. If there's a care plan that is given to you, you should always follow what's in the care plan, and also follow the what to call this the food guide, right? So it's very important, and also make sure that you know what are the do's and don'ts, the allergies, food allergies, or what type of diet the client should have. So there are different types of challenges in achieving the nutrition. It could be because of lack of finances. Family might be poor and they cannot really sustain whatever the possible diet should the client have. The time, because the family member is working and then there's nobody that will help them to prepare the meals, and it's just you, PSW, that will visit there. What else? And of course, if there's like developmental issues and obesity, so developmental issues, the client itself, it's so difficult for him to feed himself or herself, so she needs to wait someone to assist or to support him or her, right? But also school age key concerns. So when we say latchkey on a person or a school aged person or individual, a young individual coming home from school without any supervision. So they will just like sometimes they might eat or they might not eat, or maybe they will eat when their parents comes, right? So that's what we call the latchkey. That's what we call the latchkey, right? So those are some of the challenges that might happen and might affect the nutrition and development of an individual, especially the young ones. Rice syndrome awareness, when we talk about rice, it is linked as a link to rice syndrome in children. So there might gonna be something to do with the aspirin. It occurs during the viral infection recovery, and symptoms might be nausea, confusion, seizures, and emergency seizures, right? So there might be some things that might happen usually if the client is having aspirin, and it might lead to rice syndrome, especially for children. So vaccination and community immunity. So it's always advisable, especially for babies to children to teenagers, to have completed vaccination, right? And there is a high level of vaccination, like taking all the vaccination that is required, then there might be lower disease burden. Okay, because there is like immunity, there is something that will fight inside the body from any harm or any immunity diseases or communicable diseases. So it actually protects the individual, even the group of individuals. And then it will give lower rates for disability or death risk if vaccination is complete. So what are the things that we need to consider in terms of like taking care of children? Again, making sure that children require developmentally sensitive care. There might be some words. It's not just taking care for them physically or assisting them with their else, but also how are developing them, especially if you are there mostly of the time because the parents are working. So you will build their behavior, their personality, etc. Right? So that's why it is a sensitive care. There should always be a stability and nutrition and routine that you're giving to them. And of course, as what we have mentioned, the behavior, the vaccination, and hygiene, because those are the prevention pillars, right? Those are the prevention pillars. So again, just to add up with regards to the definition or terms. So when we say infant, it's baby from birth to 12 months. Those sometimes extends to age 2, right? That depends. When we talk about when we say child, it's young human being from birth through infancy and puberty, like legally considered a minor under 18 in many places. While teen, a person between the age of 13 to 19. This stage of life is often referred to as adolescence, representing the transition from childhood to adulthood. So those are just some of the definitions that I think it's good. It's a reminder for us. For sure, some of us or most of us already aware of what these definitions or terms mean, but this is just a reminder. So that's it for today with regard to chapter 2. It's very quick because it's just like an overview of infant, child, and teen. So if you want to read further about this topic, you can always go to your Elsevier 2022, Caring for the Young, chapter 42. All right, that's it for today. I'll see you again for the next chapter.